Excellent. So continuing on the theme, we're going to talk about Dapoxetina for premature ejaculation. Now, I know Marcelo has kind of covered some of the mechanism of action. I'm going to focus more on the review of the newer literature, some clinical outcomes, and final conclusions that we can derive from this. Now, the mechanism of action, as Marcelo had described earlier, Dapoxetina is a selective serotonin reuptake inhibitor, and because it inhibits the neuronal reuptake of serotonin, there's subsequent potentiation of the serotonin activity, and since serotonin neurotransmission is related to the pathways that control ejaculation, it delays ejaculation in a high proportion of men who take this. So Dapoxetina is definitely a very unique treatment option for patients with premature ejaculation. This is a review of the most recent evidence. So in 2019, Tuke and al. Performed a study looking at the efficacy and safety of Dapoxetina with sildenafil in the treatment of men with premature ejaculation and concomitant erectile dysfunction. Now, this is really interesting because most of the guys that we're taking care of probably have a little bit of erectile dysfunction as well with the premature ejaculation. And so it's very interesting in that we're prescribing sildenafil to many of these patients to begin with. Combining this with Dapoxetina is likely to have a better effect. In this study, they were giving a combination of 30 milligrams of Dapoxetina with 50 milligrams of sildenafil about 1 to 3 hours before sexual intercourse for 4 weeks. Patients had to take this twice a week at least, and there were 73 patients. What we found was that the ILT was statistically significantly improved with the combination therapy. All the parameters measured, premature ejaculation profile score, IIEF, all improved, and 81% of the patients were satisfied with the treatment. This is really powerful in that it gives us one more medication that we can add because in many of these guys we're giving them sildenafil to begin with, and adding the Dapoxetina can significantly improve the intraejaculatory or intravaginal latency times. What was also interesting to see is that the side effects were mild and transient with this combo therapy. Zhao et al. In 2019 also performed a large systematic review and meta-analysis of about 276 papers, and they narrowed down to the selection down to about 8 papers with a total of 8,422 subjects. The pooled results indicated efficacy in both the intravaginal latency time and also the personal distress related to ejaculation. Subgroup analysis also indicated that there was improvements for all the different types of dosing with Dapoxetina, so 30 milligrams, 60 milligrams on demand, and also with daily 60 milligram dosing. All 3 subgroups showed improvements in all measures. The safety profile, again, was acceptable, very minimal side effects. In 2020, Peng et al. Published a study looking at the efficacy of Dapoxetina treatment in Chinese patients with premature ejaculation, and also kind of measuring it to see how it would affect in real-world practice. What they did was also included a measure of number of intravaginal thrusts before ejaculation. The theory was that for many of these patients, even though we prescribe the meds in a certain way, in real-world settings, how effective is this medication therapy, and do patients really see some improvement? And what was interesting is that at least 70% of the patients on self-evaluation said they were at least slightly better with the use of Dapoxetina. This study went into detail in terms of some of the adverse events, and the adverse events or complications reported were only reported in about 32 patients, about 20%, and these included things like headache, dizziness, nausea, somnolence, and nasal congestion. Again, patients with less severe premature ejaculation seem to have better efficacy with Dapoxetina, which makes sense. But overall, this showed that even in real-world situations, the effect of this medication was quite significant for these patients. Balchi et al. In 2019 compared paroxetine, fluoxetine, and Dapoxetina in low socioeconomic status patients with lifelong premature ejaculation. Now, when you think about it, this is probably one of the worst groups, but we see a number of these patients in clinic. And there were about 170 patients in this study. Premature ejaculation profile and intravaginal ejaculation latency times were recorded. Paroxetine 20 milligrams was given in group 1, fluoxetine 20 milligrams in the second group, and Dapoxetina 30 milligrams on demand in group 3. All measures, again, were improved in all 3 groups. However, Dapoxetina 30 milligrams had a lot less side effects than the other two medications. Treatment was terminated because of side effects by 8 patients in Group 1 and 9 patients in Group 2, and none in the Dapoxetina group. And so this is quite powerful, showing that the side effect profile was significantly better for Dapoxetina compared to some of the other SSRI medications. DuAL in 2019 also studied the efficacy and safety of on-demand Dapoxetina in treatment of patients with premature ejaculation. They did a large meta-analysis. This was an analysis of 11 randomized control trials, almost 8,521 cases with 4,338 controls. So this is one of the largest meta-analysis of this type. And again, all the parameters measured: intravaginal latency time, the adverse events, the patient-reported global impression, with on-demand Dapoxetina was significantly higher than in the control group. Therefore, this again shows that Dapoxetina is effective, it's safe for patients with premature ejaculation, and a dose of 60 milligrams may be more effective than 30 milligrams with a comparable side effect profile. Zhao et al. Also studied the beneficial effects of combining Flomax or tamsulosin with Dapoxetina in the management of patients who had prostatitis with premature ejaculation. Now, this is also very interesting because the majority of our patients, again, are likely to be on Flomax or tamsulosin. Many of these patients have bladder atlas symptoms. And what was interesting is that the combination of Flomax or tamsulosin and Dapoxetina provided a much better therapeutic efficacy in the treatment, not only of premature ejaculation, but also in the chronic prostatitis symptoms, really showing that there was a synergistic effect between Dapoxetina and tamsulosin. Again, this really illustrates the benefit of using Dapoxetina because many of our patients are already on tamsulosin or some of these other medications, such as sildenafil, and it really seems to potentiate the effect for these patients that also have premature ejaculation. Al-Hamid did a comparison of the clinical efficacy and safety of on-demand paroxetine, Dapoxetina, sildenafil, and combined Dapoxetina with sildenafil in a group of patients with premature ejaculation. Again, what was interesting here is, again, it was the combination of Dapoxetina and sildenafil had the best values or improvements or satisfaction scores. What's also interesting is that combining Dapoxetina and sildenafil could improve premature ejaculations even in patients without erectile dysfunction. Now, obviously, it kind of shows the synergistic effect of combining these meds and really taking those effects or the benefits further. So again, really making this quite an attractive drug to use in our patient groups. So with my own clinical experience now in the U.S., unfortunately, Dapoxetina hasn't been FDA approved. And so most of the patients obtain this through online sources, through websites, things like that. And what's interesting is even though it's not FDA approved, a number of these patients still get these medications. Overall, we've seen about a 70 to 85% reported satisfactory improvement with the use of either the 30 milligram or the 60 milligram Dapoxetina. However, the 60 milligram Dapoxetina appears to be more effective, and this is taken on demand 1 to 3 hours prior to planning to have intercourse. There's minimal side effects. But in the U.S., we seem to have poor long-term compliance due to difficulty in obtaining these meds. And that's why in Chile, this is great that Dapoxetina is being made available. And I think, if we had the opportunity to use this in the States, we definitely would. So in conclusion, what we can see from the data and the literature is that Dapoxetina is effective and safe for patients with premature ejaculation, and a dose of 16 milligrams may be more effective than 30 milligrams. What's also interesting is that the effects could be potentiated in patients who are taking Flomax or sildenafil, and the side effects are very tolerable for most patients.